Do you ever have pain in your vagina that comes out of nowhere and you have no idea where it's coming from? You need to watch this video and I will explain exactly where that pain is coming from and what you can do to start to fix it today. We're gonna go into where this is coming from and 2 tips where you can integrate these tips into your daily life to help manage this discomfort. Most of the time, when people get pain in their vulva or in their vaginal area, maybe it's your growing area, it's super uncomfortable, right? You might go to the doctor and maybe the doctor will run a test to see if you have a urinary tract infection or if you had contracted some STIs or STDs, sexually transmitted infections or diseases, and they'll rule that stuff out. But you're still left with this pain. They might refer you to a specialist. You might see a colorectal doctor. You might see a urogynecologist. All these fancy terms for specialist doctors that are gonna try to figure out where is your pain coming from. But this video is gonna show you exactly where your pain might be coming from and how to start treating it today. The pelvic floor is responsible for the function of everything in your growing, okay? So I'm gonna show you what the pelvic floor looks like. This is a group of muscles, tissues, nerves, and blood vessels that is between your legs, all right? There are 3 holes that run between the pelvic floor. It is your vagina, your urethra, and your anus. All right. And when you have pain in these areas, or you feel something achy or dull, or like you're sitting on something doesn't feel right between your legs, oftentimes that pain is coming from the actual pelvic floor itself. All right. Pelvic floor is 3 layers of muscles. And when it can provoke different levels of pain and different symptoms. Some of those symptoms can feel like a spasm or a gripping inside your anus. Sometimes it can be just like a constant feeling like you have to pee. And maybe that's why you think you have a urinary tract infection, because you're just constantly feeling like you have to pee. And it's a really annoying feeling because every time you go to the bathroom, you don't actually have to pee, and it's not relieving that discomfort when you do go. So some of that can be related to these muscles of the pelvic floor. Let me tell you how that works. All right, so the pelvic floor muscles, they do 3 things. They contract, they relax, and they overstretch. That is 3 different motions that the pelvic floor has. So it contracts, it relaxes, and it overstretches. It overstretches for when you need to poop. It overstretches for when you have a baby. It overstretches for when you pass gas. When it contracts in reaction to your foot hitting the ground, or if you cough, it contracts to hold things in, and then it should live in a relaxed state. And that's the state we want the muscle to live in. However, if we start to get pain in these areas like the vagina or just in the growing in general, sometimes people feel this in like their lower ab area. So like right above the pubic bone. So like underneath your belly button, essentially. And if you're having this kind of pain or discomfort in those areas, then that can be coming from your actual pelvic floor itself. So you might be asking me, what do I do about this? Yes, I have that stabbing pain in my anus, or I get times where I just feel like I have to pee constantly. Some people also feel like they can never engage in like sexual intercourse because it's just too uncomfortable. Either initial penetration is too uncomfortable or deeper thrusting is too uncomfortable. Sometimes positions are off limits because it's too uncomfortable. And if that's the case, then most likely it's because something isn't working in your pelvic floor. And most of the time, it's because we are living in this overcontracted, really tight state. So in order to help stop this pain and discomfort, I want to teach you 2 tips to help you control the pain and help alleviate some of this pain and discomfort. All right, the first tip I want to give you is going to be just a gentle relaxation tip for the pelvic floor. It'll be a really gentle stretch and it should feel kind of good. All right, it's going to be a hip opener. Because the pelvic floor is located inside the pelvis, it's hard to actually stretch this because it's hard to open up the pelvis and really, stretch both ends where the muscle attaches and where it inserts on the other part. It's hard to stretch that. So I'm gonna give you one stretch that's gonna help open up all the muscles that attach to the pelvic floor and help bring some motion to the pelvic floor itself. This can help start to relax these muscles, so it can help that relaxation of the muscles, which is then gonna help bring some blood flow, bring oxygen to the tissue, and can really truly alleviate pain. So join me in this stretch as we go into our pelvic floor relaxation and helping relieve the pain that you feel in your vagina. All right, so in this position, I like to do it laying down. You can do this in a modified seated position, and we can go into that as well. But I like to bring the soles of my feet together and let my knees fall apart. And then you want to feel the stretch in your inner thighs and help open up this whole area. If you're wearing blue jeans like myself, you might want to wear more of a comfortable yoga pant, and that can be helpful. When you're in this position, you're just letting your knees fall. If that feels too aggressive on your hips, then I would like you to put pillows underneath the sides of your knees. And this is, again, just a really nice opener of all the muscles that attach to the pelvis and will help open up some of the layers of the pelvic floor as well. So when you're in this position, I recommend holding this stretch for 60 seconds to 5 minutes. You're gonna do what is tolerable for you. A 30-second stretch here isn't gonna cause enough tissue change to really make a difference. So the longer you can tolerate holding this, the better. And it should feel very relaxing. And if it doesn't feel relaxing or you're really straining to get into this position, I want you to add pillows underneath the sides of each leg. Here is what that looks like in order to add the pillows to the sides of the legs. You should feel like you're more supported as you lay in this opening position, really feeling the stretches on your inner thigh. And it's a very slight, gentle stretch. It's not like you're cranking into your hamstring. You're like getting a really deep stretch. You should feel like you can hold this and truly relax into this type of stretch position and feel very supported in this area. So hold this 60 seconds to 5 minutes, and this will be the first way that you can start helping decrease the pain in the pelvic floor and inside the vagina. The next tip I am gonna give you is gonna be a breathing tip. We are gonna breathe deep into our pelvic floors, helping relax and open our pelvic floors. So join me here as we go into a nice diaphragmatic breath with pelvic floor opening. Again, I prefer to do this in a laying down situation. I feel like I can relax more in this situation, helping make my breath a bit more effective. So I'm gonna do a diaphragmatic breath, and I'm gonna let you watch where the air goes inside my body. Now I'm gonna have you join me. And as you join me and bring that air into your abdominal region, I want you to imagine that the air is going all the way down between your legs, allowing your sit bones between your legs to flare open. So see if you can imagine that the little bones that are between your legs, see if you can imagine that as the air goes down into your belly, you are opening those sit bones, okay? So deep breath in, air into belly. You're not forcing anything and you're just allowing those sit bones to open. Exhale and feel the recoil in the air leave the body. Inhale and open. Exhale. the air leaves the body. Now, if you want to tune your attention more to your anus, you can think about inhaling and opening your anus, exhaling and letting it go. This is going to help establish, again, that relaxation and overstretch of the pelvic floor, because a lot of the pelvic floor discomfort and pain, achiness, irritation, feeling like you constantly have to pee, that all stems from a very tight and contracted pelvic floor. So you can start controlling these symptoms by inhaling and opening and doing this type of breath pattern. I recommend doing this type of breath pattern for at least 5 minutes a day in order to help start opening up that pelvic floor muscle and releasing the tension of the pelvic floor. I'm gonna have you join me for a bonus tip. I really appreciate you watching this video, and for staying tuned this long. Please enjoy this bonus tip that can truly help change your pain that you're feeling between your legs. So here we go. If you are constantly finding yourself clenching your glutes, or like you're doing the dishes and you feel like you're squeezing your butt, I want you to try to relax your glutes, relax the butt. So it's not constantly clenching and holding, and I want you to check in with that area and relax the glutes. If you are clenching the glutes, that is going to overflow into creating to clenching the pelvic floor. And that can cause a lot of the perpetual tightness and discomfort that is creating the pain. So, bonus tip here, decrease the amount that you clench your glutes. This is going to take awareness. Just check in with your glutes a couple times a day. When you're doing the dishes, when you're brushing your teeth, when you're working, just check in with them. Are they constantly contracted, or can you relax them? All right, well, thank you for tuning into this video. If you enjoyed this video, please like it, share it with your friends, follow us, subscribe. We are so grateful for what you bring to this channel and this community, and I hope you find this information valuable. I'm Dr. Allison Felt, owner of Body Motion Physical Therapy, located in downtown Edmonds, Washington, and Poulsbo, Washington. And we help people that have pelvic floor pain that we discussed today, or pain in the vagina, or any of those areas that I mentioned in this video. So if you are in that category and you know that you're ready to get help, I would love for you to watch our video of how to find a pelvic expert physical therapist and what a pelvic expert physical therapist is. I will link that video to the description here so you can enjoy that video. Again, thank you so much. Please like and subscribe and share. Ask questions below. I hope you find these tips helpful, and I'll talk to you soon.